Hello and welcome to Studio CAG. I am Ashika, your host for today. Do you know that non-communicable diseases are one of the biggest killers in the world? Non-communicable diseases or NCDs are diseases that are not infectious. We cannot catch them and therefore they do not spread from person to person. Instead, these are primarily caused by smoking, sedentary lifestyles, our eating patterns, and so on. NCDs globally kill 41 million people each year, and 86% of these deaths are happening in low and middle income countries. Cardiovascular diseases account for the most NCD deaths, 17.9 million people annually, followed by cancers, which sums up to 9.3 million. So, while we might worry about cancer, which is also on the rise, the chances of succumbing to cardiovascular disease is much higher. Hypertension or increased blood pressure is the most implicated cause of cardiovascular disease and death. Like with NCDs, the incidence of hypertension is higher in low and middle income countries. To understand patients' perspectives on hypertension treatment and the facilities available to them at government healthcare centers, a study was conducted by the CAG in Tiruvannamalai district of Tamil Nadu. The study aimed to document the experiences of hypertensive patients, particularly those from low-income communities, receiving treatment in government healthcare facilities. Join us as we talk to Subramani, researcher at CAG, to discuss the findings. Hello Subramani, can you tell us what your research looked at and what your research questions were?
Hello Ashika, thank you for having me on the podcast. In our recent study titled Voices from the Last Mile, Personal Narratives of People Living with Hypertension in Tiruvannamalai, conducted by CAG, we delved into the patient's perspective on hypertension treatment. Specifically, we focused on how easy it was for individuals who rely on the government hospital services to access hypertension treatment. Our research took us to rural areas in Tiruvannamalai district in Tamil Nadu, where we engaged with a diverse group: daily wage laborers, self-employed individuals, agricultural laborers, housewives, and senior citizens. These are the people who don't frequently visit clinics or hospitals for treatment. We explored their experiences with hypertension management, paying close attention to the treatment offered by primary health centers in their villages. We asked critical questions. Is the PHC functional round the clock? Are essential medicines readily available? How accessible is the clinic? What's the quality of treatment? And importantly, do these individuals feel comfortable with the public health centers or do they prefer private clinics? Additionally, we investigated how they access treatment, whether it's free or paid. We spoke to around 120 patients from 17 PHCs comprising 3 blocks: Thandrampattu, Tiruvannamalai and Mangalam.
Can you give us some data on what is the incidence of hypertension in India?
Uncontrolled blood pressure is one of the main risk factors for cardiovascular diseases such as heart attacks and stroke, and globally are the most common cause for death. CVDs are also responsible for 1/3 of total deaths in India. Every 1 in 4 Indians has high blood pressure and is at the risk of adverse events from hypertension related cardiovascular diseases. Of the estimated 220 million people in India living with hypertension, only 12% have their blood pressure under control. On the occasion of World Hypertension Day in 2023, the Ministry of Health and Family Welfare took a momentous step, the launch of ambitious 75 by 25 initiative. With the goal of combating NCDs, particularly hypertension and diabetes, this initiative aims to screen and provide standardized care for staggering 75 million individuals by 2025. By prioritizing the health of several crore Indians, the 75 by 25 initiative represents a crucial milestone in our nation's fight against NCDs. In 2020, A survey conducted by the Tamil Nadu Health Systems Reforms Project revealed a concerningly high prevalence of hypertension, that is 33.9% among the adults in the state.
How is the Tamil Nadu government trying to address this pressing need?
Imagine a world where healthcare comes knocking on your door. That's the vision behind the Makkalai Thedi Marthum scheme, an initiative launched by the Tamil Nadu government in 2021. This program is revolutionizing hypertension care by bringing it right to people's homes. At the heart of the MTM scheme are local women health volunteers. They are trained to screen for hypertension and other medical conditions. They go door to door armed with compassion to ensure that everyone has access to essential health care. They deliver medications directly to the patient's doorstep, eliminating the need for long journeys to healthcare facilities. This not only saves time and money but also ensures consistent treatment. As of July 2023, over 1 crore individuals have been screened and 60 lakh people with hypertension are receiving treatment.
Your study was done among people living in Tiruvannamalai. So, why did you choose Tiruvannamalai as your research site, and which methodology did you use?
Tiruvannamalai is often cited as one of the backward districts in Tamil Nadu with its significant rural poverty. Situated in the northern part of Tamil Nadu, it is predominantly an agricultural district. Despite its proximity to Chennai, which is just 196 kilometers away, it remains relatively underdeveloped in terms of industrial production. The district has 28% of population belonging to the marginalized communities. Despite being considered one of the poorest districts, Tiruvannamalai plays a crucial role as a major rice producer in the state. Agriculture remains the backbone of the local economy. However, the district faces challenges in terms of literacy rate, ranking low among districts in Tamil Nadu. Consequently, CAG chose Tiruvannamalai as the location for the pilot study as it aimed to understand equitable health services. CAG collaborated with Sinam NGO in Tiruvannamalai to mobilize patients receiving treatment for hypertension at primary health centers. As I had mentioned earlier, we interviewed around 120 patients using a questionnaire that included both closed and open-ended questions. We also held focus group discussions, thus considering both the quantitative and qualitative aspects of the survey. In total, we surveyed 17 PHCs across 3 blocks. Over 60% of the respondents were daily wage workers and agricultural laborers. We also interacted with the NCD staff nurses and women health volunteers.
Can you tell us how well hypertension care is reaching the masses in Tiruvannamalai? Is it mostly good or poor?
The survey has revealed positive feedback from the patients regarding the functioning of primary health centers, particularly in relation to hypertension treatment. Women health volunteers providing doorstep drug delivery and periodic screenings seem to be beneficial for the patients. Over 60% of the respondents are daily wage and agricultural laborers and those engaged in the MG and REGA scheme projects. For these individuals, the presence of women health volunteers providing screening services at their doorstep or at workplace and delivering medicines has proven to be very useful. They express satisfaction with the medicine distribution process. According to the survey results, 73.3% of patients receive follow-up calls or intimation from the women health volunteers for their periodic checkups. The patients consult the doctor in a particular month, following which medicines are supplied at their doorstep for 90 days. This effort of extended prescription refills by the government is a much appreciated norm worldwide.
As you've talked to so many people, were there any difficulties that they reported in accessing the schemes?
There were a few concerns that were brought to our notice that indicated there were a scope for improvement. A significant challenge encountered was the similar packaging of medicines for various treatments. Our survey revealed that 80% of the hypertension patients also had elevated blood sugar levels and were on medication for diabetes mellitus and other comorbidities. This means that they had to take more than one type of medication. A case in point is the packaging of atorvastatin 10 mg, amlodipine 5 mg and glipizide 5 mg, which are almost identical with only slight color variations in the medicine strips. Given the patient's literacy levels, they struggle to identify the correct medicines. Another identified issue was at the SC Gudalur PHC, which serves the people for Tantrampattu and nearby locals. This PHC is remotely located and lacks proper public transportation. Public transportation facilities significantly influence patient accessibility to PHCs. Not everyone owns a vehicle and many rely on public transport. Inaccessible sites might force patients to rely on private transportation for at least a part of their journey. Providing free medical treatment and medications while patients incur substantial transportation costs is counterproductive. Also, our survey revealed a significant concern regarding what we refer to as the NCD day at PHCs. NCD days are one day of the week when the PHC offers treatment provisions for NCD carer, that is, this is the day when respective doctors and diagnostic facilities are made available for patients. This poses a substantial burden on the majority of patients who are daily wage laborers. The necessity to take time off work forces some individuals to forego their screenings to avoid wage loss. Those prioritizing their health are compelled to sacrifice a day's earning for their follow-up, creating a paradox where free treatment results in financial loss. This issue is not unique to Tiruvannamalai but is prevalent across the country, undermining the PHC's objective to provide accessible healthcare services at all times. With continuous monitoring, adaptation and commitment from all stakeholders, we can strengthen the healthcare system, improve outcomes and enhance the lives of those living with hypertension in Tiruvannamalai.
Thank you, Subramani. A reminder to our listeners that, as we said at the beginning, NCDs are usually the result of behavioral factors and lifestyle choices. This could potentially be a good news. If we can make those behavioral and lifestyle adjustments, we could potentially drive down our risks of these diseases. Smoking and alcohol use, these might not surprise us. Do you know that excessive salt intake is another significant risk factor for hypertension and cardiovascular disease? Can you believe that 1.8 million deaths every year are from overconsumption of this apparently innocuous substance? Reduce your salt intake. 5 grams a day or 1 teaspoon is the safe limit. Stay under it. Watch out for those processed foods that contain high levels of salt. Sedentary lifestyles are another important factor. Walking, cycling, taking the stairs, exercising helps us. Each of these count towards a healthy heart. For over 30 years now, Citizen Consumer and Civic Action Group has been working to protect citizens' rights in consumer and environmental issues and promote good governance processes including transparency, accountability, and participatory decision making. This podcast series, Studio CAG, like our work itself, will cover various areas of interest to the average citizen and consumer. Follow us on our social media pages, CAG Chennai, Facebook, Instagram, Twitter, Threads, and LinkedIn to keep yourself updated of both social and environmental news. Our website www.cag.org.in and our YouTube pages will also have loads of information which might be of interest to you. Until we meet next time, goodbye.